collimator light. Okay, we want this to be at 40 inches. Okay, notice where it says tabletop.
So over top of the 40 or
Let's
Go up on the left.
On the
So
left.
still vertical.
still vertical?
Push it up.
Push it up.
keep going.
37,
Keep
38, 39.
Oh, on the left side. So over top of it?
Right there is fine.
Okay.
Okay.
So it doesn't matter where our SID is?
End
This
of
is
the table is.
tabletop.
Got it.
Okay, 40 inches. Now, transverse, pull it out.
Pull it out. So, how does that work?
Transverse button.
Uh-huh.
Is there one? Push it in.
Uh-huh. And,
Pull it towards you.
oh,
There you go, until that's centered. There you go, just like that. Okay, it should lock. Now make it smaller. So it's all about patient preparation.
Okay.
Okay, make it smaller. Make it smaller. We want a collimation. Okay. So this notch needs to line up with this. Your X needs to be in the middle of this. Okay. That's probably locked there. That's fine. Okay, good. Okay, now you get yourself ready. The marker. All right. It's at right elbow. So okay, look for the crease.
that needs to be there.
Okay, antecubital fossa, and that's it. Lift up, new cassette comes back, lateral, okay. Lift up, new cassette comes in. This is your tangential, okay. And then I go back to my neutral lateral with the tube back there with a 45-degree tube tilt up towards my head. No, you don't have to do it now. That's it, so it's all about this first, 40 inches, then bring the patient's body part into the area that you've lit out. All right?
How far back does it go for the 45-degree tube tilt?
Well, it depends on where this is and where you'll go closer to Stefano.
Want
So
me to
that
try that right now?
you can.
Let's see, right here, so, and then we do 45 degrees. Alright, just in case, close your eyes.
So this lines up.
Ah, okay, okay. I
And you have
gotcha.
to change your collimation. Okay, so if you found something that bothered you on your AP and lateral, so then you just do this, and it's got a 45-degree tube tilt, you're good to go.
Okay.
Lift up. It's always the patient tolerance.
Is
okay?
that still between the two condyles? Okay.
Okay. All right, so that's elbow exam. Wrist exam. Come back to 40. Lights. Okay. So wrist exam between the radial and ulnar styloid process. Okay. Now you can also do this. Put the PA here and then the oblique here. You're going to need another cassette, but on the others in the clinic it's going to be digital anyway, so it's moot. Okay. So PA between the radial and ulnar styloid process. Notice my fingers are off the cassette. Oblique. Still the central right here. Lateral into the anatomic snuff box. Okay, whether the thumb is up or down doesn't matter to me. Okay, and then ulnar deviation to emphasize the scaphoid, or radial deviation to emphasize the TFC region. Depends on where the patient's pain is. Is it lateral, medial, or lateral? Okay, in anatomic position. All right, so this way or this way. Okay.
So going from A to P, when you're doing radial ulnar deviation, you keep the hand in the same spot, just ulnar or radial deviate.
Yeah.
That's P to A, isn't it?
It's always P to A.
Oh, sorry, P to A.
Okay, I'm not interested in the fingers, I'm interested in the wrist joint. And in this position, I'll elongate the styloid process if they have anatomic snuff box pain. If they have TFC pain, I do this, I want to make this area bigger. And notice I haven't done anything except rotate the wrist. Okay?
Mm-hmm.
All right, that's the wrist exam. Hand exam, PA, notice I haven't touched the collimation, that stays the same. Goes to the head, shaft, and base, the head of the third metacarpal. PA, oblique, lateral, and semi-supinated. And you can do one supination at a time, but usually they'll say, you can do that. The reason we do bilateral is to give it a comparison if I had pain in both hands. Okay, so
Semi-supinated is on the ulnar aspect.
no, semi-supinated is still the head of the third metacarpal. Okay, so right out there.
Yeah.
Okay, PA,
Mm-hmm.
oblique, lateral, semi-supinated.
Got
Okay, still the
You're
head
still
of,
getting.
Still on the third.
yeah, no, I want to be able to see the fingers on the first three. Semi-supinated, I'm interested in the metacarpal heads. Okay, so as long as your distal tips are within the area exposed, that's fine.
And these are all at 40.
Everything in the extremities is at 40 inches.
And when the patient places their hand on board, do we move their hand or we work
No,
with
no.
the... Okay.
Down,
In between each.
down. You don't move this.
Okay.
If you move this, you've got another thing to move besides their hand. You get yourself organized, dot, 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 and this.
Okay, for our practical, is it okay just to verbalize that we're using a new
Yeah, that's fine,
film?
okay?
I'm sorry, the semi-supinated was for you to get a good, clear view of.
Metacarpal
The
heads.
third metacarpal head.
The center ray goes to the same place that it did with the others. The third metacarpal head. Okay?
Got it.
Now, if it's a small hand, yeah, that'll fit into that space, okay? But then we make our collimation bigger, I mean, but that's old technology because we're using the cassette. When you're in the clinic, you're just going PA, oblique, and lateral, it's point and shoot. Once you've exposed the area that you're gonna expose, okay? We don't do this, we don't have to do this because it's digital, you go PA, click, oblique, click, lateral, click, and then semi-supinated if you wanted to. It's just this has to be upright and we don't, that's
The
all we have.
lateral, you tuck the thumb down or
Doesn't
it
matter.
doesn't matter? Okay. It could be either way. Okay. Thank you.
Okay,
Yes.
all right,
What's the one?
that's just another way of doing an oblique view.
Okay.
Oh, that way they don't have to
Oh,
hold
so
their
what
hand
That
up.
way they get the angle right.
Well, I mean, they don't know what 45 degrees is. I just say, put your hand flat, yes, lift up, can you put your hand like this? I approximate what I think is 45 degrees, spread your fingers. So some people like to do this, so they can get it flatter, that's fine, either way is acceptable, okay? And then the lateral is stacked, whether the thumb is up or down doesn't make any difference. We've got most of our information on the PA and the oblique view,
Okay.
okay?
Mhm.
Now,
Depends if they can do this.
Yeah, they may not be able to.
right. Smaller body parts, so if they have IP pain, I mean, you can imagine, it's a small joint to begin with, we can't just use two views, AP and lateral, or right angle view, that's why we want tangential as best we can. Each view has a specific purpose. This is if I have soft tissue swelling, I can see it. Now I'm just demonstrating radiographically. If I have palmar soft tissue swelling because it was pierced by a tattoo artist, I should have a lot of swelling there, right? Okay, but clinically, you've already seen the lump, you're just documenting the lump. My argument is document the lump with your cell phone. You've got now a picture archive and an x-ray archive.
Yep.
Okay, now the reason that's important on x-ray, if you have soft tissue swelling about a joint, there's probably a little fracture there. No soft tissue swelling, so if the tube is cylindrical and it's the way it is anatomically, you do not have a fracture. So soft tissue swelling is important because we have superficial joints.
Yep.
Okay? That's why the ultrasound, they can get with the ultrasound into the superficial and deep tissues. So ultrasound really shines with acute superficial extremity injury.
Okay.
Hand, elbow, not so much shoulder even so now, okay? Knees and ankle, feet. Okay?
Thank you.
All right, I'll make a recording of wrist and hand, so you have something on the weekend. This is week 3. Week 4 would be practice normally. Week 5 is to be your upper extremity exam, so we'll give you we've missed a week, so we'll push it back, but that's how quickly this is going. All right,
Are we still, so week 5, we're having the exam?
well, it'll actually be
Week 6.
week 6,
Practical.
yeah.
First written is when?
We can do the practical week 5 that Thursday,
And
and
written.
knock out the written, I mean, the
Okay.
practical in week 6.
Okay. Sweet.
Are these all
Written
of
week
our
5?
Week six.
views for the
All
first
week six.
practical?
No, written.
No, written.
He said written week 5.
Did you say these were all
And
of our
practical
reviews for the
week
first?
Shoulder, elbow, wrist, and hand,
Okay.
2 weeks.
okay?
Got it.
If you haven't submitted your project yet, you can send, I'll put it on the board, my email address, ndxray@outlook.com.
Actually,
I
I was
crit-
able to upload it for at the discussion board.
We created a new discussion.
Yeah,
Test-
it
test
was called
one.
test 1, so we
It
all
was like
put it in there.
attendance one, and we just
Yeah, we all
kind of
put
like
it
That's
on
fine.
it.